Chronic knee pain is one of the most misunderstood problems people deal with. And here's the uncomfortable truth most people never hear. If you're relying on rest, ice, and pills to manage your knee pain, you may actually be making it worse over time. That sounds backwards, I know. Rest is supposed to heal. Ice is supposed to reduce inflammation. Pills are supposed to control pain. And in the short term, they sometimes do. But when knee pain becomes chronic, those same strategies can quietly work against you. Many people follow the same cycle. Their knee hurts, so they stop moving. They ice it. They take medication. The pain eases a little, but it never fully goes away. Then the moment they try to return to normal activity, the pain comes right back. Over time, the flare-ups happen more often, last longer, and limit more of life. The problem is that chronic knee pain is rarely just about inflammation alone. It's usually about how the knee is functioning. It's about how it's being loaded and how well it's being supported during everyday movement. Let's start with rest. Short periods of rest can be helpful after an acute injury, but long-term rest sends the wrong message to the knee. Joints are designed to move. Gentle movement circulates joint fluid, nourishes cartilage, and keeps surrounding muscles active. When you rest too much, the knee becomes stiff, under-lubricated, and less prepared to handle stress. Muscles around the knee also weaken with prolonged rest. Some muscles stop firing properly, while others tighten to compensate. This imbalance changes how force moves through the joint. So when you finally do move, the knee experiences more strain, not less. Now let's talk about ice. Ice can reduce swelling temporarily, which is why it often feels good in the moment. But inflammation is not always the enemy. In many cases, low-grade inflammation is part of the body's attempt to repair and protect tissue. Constantly numbing that process can interfere with circulation and healing. Overusing ice can also dull important signals. Pain is information. When it's constantly masked, people often return to the same movement patterns that caused the problem in the first place without realizing it. Then there are pain pills. They do nothing to correct alignment or restore muscle balance. They simply turn down the volume on pain. Meanwhile, the mechanical stress on the knee continues day after day. This is why so many people feel stuck. Walking feels harder. Standing up takes effort. Stairs become intimidating. Confidence fades. Another issue is fear. Chronic pain changes behavior. People move less because they're afraid of making things worse. Ironically, this often accelerates decline. Less movement means less joint nourishment, weaker muscles, and more stiffness. Body weight can further complicate this cycle. Extra weight increases pressure through the knee during standing, walking, and stairs. This doesn't mean pain is your fault. It means the knee is under constant stress with limited support. What most people are never told is that chronic knee pain often needs a different approach. Better support for how the knee moves. This includes improving alignment, restoring gentle motion, and reactivating muscles that protect the joint. When the knee is supported correctly, inflammation often calms down on its own because the source of irritation is reduced. This does not mean pushing through pain or forcing intense exercise. In fact, aggressive workouts can make chronic knee pain worse. Many people are surprised to find that small, consistent actions can make a noticeable difference. Short routines done at home, gentle movements that restore circulation, simple techniques that reduce unnecessary strain. Over time, these changes add up. Chronic pain convinces people that something is permanently broken, but in many cases, the knee is not broken. It is overwhelmed. This is also why surgery is not always the first or best step. Surgery changes the joint forever. Many wish they had explored supportive options earlier before pain and fear took over their daily life. If your knee pain has lasted months or years, that doesn't mean nothing can help. It means the usual advice may have been incomplete. Your knee is not asking to be shut down. It is asking to be supported differently. There are resources available that focus on gentle, at-home methods to improve knee comfort, movement, and stability. Chronic knee pain does not have to control your life. With the right approach, it can become something you understand and manage.